Hi guys, how's it going? My name's Vincent and today I want to talk about coffee cups. So this is me. I'm a medical student and this was me on my first day of medical school. And I'm currently a third year student at St. Vincent's Hospital. And as I've entered the healthcare system, ideally to help people, I've realised that a lot of healthcare actually harms. And despite what the Hippocratic Oath says, and despite what actually a lot of doctors and nurses do, there is still a lot of inherent harm in running hospitals and delivering healthcare. So what does that look like? Well, healthcare emits about 7% of all of Australia's emissions. For context, that number on average globally is 4.4%. And 7% is actually equivalent to all of South Australia's emissions, and it is actually greater than all of shipping and aviation emissions combined. And that's pretty crazy because we're not cutting down trees, we're not mining resources, we're not doing anything on the surface that seems to be inherently unsustainable. And yet we're doing more than all of the planes and ships in the world to contribute to emissions. And that just didn't sit quite right with me. So I did a little bit of exploring as to why that was the case, and I discovered that about 60 to 70% of those emissions comes from single-use disposable services and products, things like personal protective equipment, things that you see on doctors like scalpels and masks. And it really troubled me because sustainability is something that is at the heart of healthcare yet is so hidden, because healthcare has a vested interest in this. We've seen that in the 2019 and 2020 bushfires, when about 400 people died and over 4,000 were hospitalised. And that cost the government about $238 million. We've also seen that in the spread of communicable disease, particularly things like dengue fever in Australia, as more of Australia becomes more tropical, more humid and more hot. And we also see that in growing rates of respiratory disease, particularly due to air pollution. So, what did I think I could do as a lowly little medical student without many connections? Well, the first thing I did was join the Wattle Fellowship, and I started to really shake my fist at the system. And after I realised that that wasn't going to do much on its own, I started asking questions, and I realised that a lot of that medical waste that we see is for patient-centred care, but also clinician-centred care. We want to keep our doctors safe, we want to keep our patients safe. But there was one thing that I figured out wasn't going to help anyone, and that was coffee cups. Hospitals churn through coffee cups. I'll be 100% honest, I basically just go to the hospital so doctors will buy me coffee. But often that comes in the form of these little plastic cups, and so I started to try and figure out a way to get rid of these cups from hospital. And what I did was contact a wonderful organisation called Green Caffeine. They operate within the University of Melbourne for a closed loop kind of swap and go system of keep cups. And when I got on board with them, I thought that my change-making story would look like this. I thought I was going to be the next Greta of sustainability, but within like a really niche healthcare / coffee cup setting. I thought it was going to be fun, I thought it was going to be great, I thought I was going to change lives, but what it actually looked like was this. This is about 4 months of emails between 4 people to organise one meeting, and I think some of my closest friends in the audience can attest that I am shocking with messages. So this is probably and will probably be the most accomplished thing I will ever achieve, just organising this one meeting. But it actually did teach me something very valuable, and that was that change making is very unglamorous, that it's very hard, and that there are many hurdles that come in the way of making change. I was told that this project wasn't going to work. I was told that there's not enough funds for it, that there aren't enough people on board. So many things that made me want to bury my head in the sand and kind of just give up. But I'm glad I didn't, because at the end of it all, Green Caffeine is eventually going to come to St. Vincent's Hospital. This is the meeting here that took place after about 4 months. And it is happening. It's going to launch at St. Vincent's Hospital on World Environment Day, which is in just about a month. And what's even more exciting is that Zuki, the operator of the main cafe at St. Vincent's, operates 50 more locations across the country. And so there's more room and even more opportunities for such a system to be implemented across the country as well. Another key thing I learned is that there are people who care. I've learned that through just engaging with people in the hospital, that there are clinicians, nurses, kitchen staff, cleaning staff, everyone from the kitchen to the ward who want to make a change, and that you just have to look under the rock and realize that there are a lot of people who realize that this is a huge problem and that are willing to make change. And the last thing I think that I've learned, as you've probably heard a lot of today, is that change will take everyone getting on board. Through the Wattle Fellowship, I've been able to meet, I've had the privilege of meeting a whole cohort of really diverse, really motivated individuals, all from very unique backgrounds and studying very different things. And if I adopted the mindset that I had before Wattle, that I wasn't in a healthcare profession, then none of this would have been possible. But I realized after all of that change making that it requires everyone, whether or not you're directly related to sustainability or not, to solve some of the world's biggest issues. And so I implore everyone here today, whether or not you think you're involved in sustainability, to realize that you are, and that there are, your own coffee versions of the coffee cup in a hospital within whatever job you do. So it starts with everyone, and thank you everyone that I've met along the way.